Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and this week we're going to be discussing psilocybin for burnout with Dr. Tracy Townsend. Dr. Townsend is a Harvard-trained medical doctor, licensed psilocybin facilitator, and the co-founder and CEO of Meadow Medicine, one of the only legal psilocybin service centers based in the U.S., founded and led by an MD. Now, before we get to Dr. Townsend, just a reminder that the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And as always, if you are a clinician and you would like to learn more about how psychedelics may benefit your patients, please check out the Psychedelic Medicine Association. It is our mission to get you up to speed, to feel comfortable answering patients' questions when they might come in asking about psilocybin or microdosing things of other varieties, or I've heard about ayahuasca, whatever their questions may be. We want you to feel informed and comfortable having those conversations. So if you'd like to learn more, check us out at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Tracy.
Thank you so much for having me. I'm excited to be here.
I'm really looking forward to this conversation. By the way, if you guys are not watching this on YouTube, watch us on YouTube because Dr. Townsend's background is just, well, chef's kiss. She just like, I don't know, this you just like up the professionality of this show 5,000%. So check this out on YouTube. Anyway, hi.
I had a friend who is he's a creative director and lots of video lighting. Yeah, he helped me with this. This is not my doing.
I was gonna say, man, doctor slash interior designer. I'm quite impressed. But yes, it is a whole vibe going on there. Very impressive. For people watching, I just have one of those backgrounds that says the podcast name because behind me is just laundry. So very well done, Dr. Townsend. Very, very pretty. Anyway, back to the topic. I'm never this distractible. However, we are going to talk about today psilocybin for burnout. So I would love to talk with you, and I love having fellow doctors on here who you did orthopedic surgery. I did sports medicine, right? Very similar paths. And by the way, every surgeon out there was just like, surgery's harder. Yes, absolutely true. But similar-ish paths. And there are a lot of people in our shoes that have experienced burnout. So if you could lead us off by talking about what burnout is, what it might look like, who might experience it.
I mean, well, I think it's fair to say it's pretty rampant in medicine, and especially post-COVID pandemic, where uh, a lot of clinicians were really pushed past the point of exhaustion, which is sort of one of the three main ways that burnout really shows up, which is first this idea of ignoring our own needs and pushing past exhaustion, which is sort of baked into our culture from very early days, if we trace back our history to Sir William Halsted, which we can talk about later, who is one of the four founding fathers of Johns Hopkins University School of Medicine. And he's sort of thought of as the father of modern surgery. Yeah, pushing past exhaustion is sort of a key component of burnout. And I think another way that burnout really shows up for clinicians and doctors specifically is having our identity and self-worth tied to our jobs. So when that happens, perfectionism also starts to play a role in there, and when we can't rise to the level of perfection that we or ideals that we have for ourselves, we are constantly falling short of that for various reasons. Then our self-worth starts to take a hit. And then another way that it shows up too, I think really kind of more, this is just becoming more and more evident as medicine. I would say this is kind of like post EHR implementation, is this the piling on of external pressures, whether that be from patients or administrators or from society at large, to meet all of these demands. And it basically turns what should be a meaningful vocation for us into a series of meaningless tasks. And so you just combine that all together and you get burnout. And I say also burnout seems to really hit a peak when there's also interpersonal factors at play, whether that's personal loss of a loved one, challenges in our marriage or challenges in relationships with our children, our family. And so it seems to be, at least I'm noticing in my work now that I work specifically with doctors who are experiencing symptoms of burnout, that is almost always a factor as well. It's like, oh, you can push through and keep it together as long as your personal life is going along okay. But then, inevitably, as is the nature of life, we sustain some sort of something rocks the boat personally. And that's just when we begin to kind of really hit rock bottom.
Yeah, that makes a lot of sense. And I'd love to extend that. We may be at points referring to healthcare workers, but burnout can be applicable wide ranging. And one of the things you brought up was COVID. And I think for people who aren't in healthcare, a way that post-COVID has probably led to more burnout is we love the work from home, but it also seemingly has set up this, well, then depending on the company you're with, I can email you and reach you at any hour. It's no longer just that 9 to 5, we expected you to be answering things in the office. You had a work computer. That's where you were logged into. But now, if you're logged in at home or on your phone, there's a different expectation. I recall having a boss during COVID times, and he would send emails at all hours. And I said, would you mind hitting like send schedule for the morning? Because I don't want to turn off notifications so that I am like missing things during the day, but also I don't want to be thinking about work at 8 o'clock at night when you inevitably send 10 emails, right? And the answer was no. And so it's very, I think, company dependent on how, well, if you're applying for a job, and again, that would imply that there was like a large choice of jobs these days. But if you have a choice of job, ask the other people, what are the expectations like? Because some of these 9 to 5s have become 9 to 9s, right? Like there's just kind of no break when you work from home. I think people have like harder time putting up those boundaries.
Yes, I mean, boundary setting, that kind of ties into the self-worth perfectionism whole kind of picture as well. And yeah, you make a great point. I mean, I feel like we started experiencing that when I was in my residency training and we started to use other messaging platforms that it was hard to figure out, when to turn off and tune out of that and otherwise feeling like you're always kind of plugged in. And so, yeah, that's a huge part of it, I think, is like the technological changes in our job and then also culture kind of lagging behind that. And we haven't really developed not that medicine has a good history of developing healthy work-life sort of balanced culture. But yeah, I think that's something that I hear lots of clinicians complaining about for sure is that aspect of things.
And I feel like in society, we hit this peak of like hustle culture, maybe 20 teens, late 20 teens, the Gary V generation, right? And it was how hard can you hustle? And I feel as though that's taken a nosedive, but the amount of burnout hasn't. Like we no longer maybe build our identity around, hey, I can work 24/7, but I don't know that it has necessarily changed how many people feel as though maybe their nervous system is still working 24/7 because they can't turn off the job or like you said for other reasons. And I think that was interesting what you brought up, and I'd love to ask if there are other things like building your identity around your job that set people up for burnout more than other things.
Yeah, I mean, yeah, like medicine is sort of unique, I think, in the sense that it really is, I think a lot of people come into it. It's more of a vocation, more of a calling. And so it is harder to, and I also think what's at play here too is sort of the wounded healer archetype as well, to get a little bit into kind of death psychology, psychedelic territory about like what's really kind of the deeper kind of patterns and conditioning that are at play here. And so I think a lot of us can get into medicine. If we're not careful, there are sort of it's examining the fuel for or the motivations for our work in the first place. And so if we're coming into the practice of medicine, where we have sort of an unworthiness wound, where a core wound of inadequacy or unworthiness, well, that's going to show up in our relating to how we work because we're carrying this core identity of I'm not enough or I'm not worthy of love, or whatever it is, these core wounds that we carry from early on that are sort of baked really in the subconscious layer. And so that's how we're going to relate. Then we need to earn love, earn approval, earn whatever it is. And so we get into this vicious cycle of trying to earn more and more, do more, do more, do more, to fill that void, when really it's like, oh, let's get deeper into the root of where that comes from, shift that, and then we can relate to our work differently. And so that's actually how I think we can actually cure burnout. And it actually isn't dependent on widespread systemic change, which, like, it's like it's very easy to externalize the problem and point the finger at our systems. Yes, that's definitely at play. But what I'm really interested in is, like, how can I help you right now shift from survival, a state of survival mode, into thriving and flourishing that's not dependent on, all of the incentives within medicine changing, which is going to, who knows when that will happen. But there's actually a different way of relating to our work, so that it's actually, we're not being fueled by fear or trauma responses, or maladaptive coping mechanisms to traumas that we've experienced. We're actually being motivated by curiosity and wonder, and back to that kind of getting back in touch with what drew us into medicine in the first place.
Yeah, absolutely. And I think that goes for all of the jobs that are vocations, teachers and maybe clergy and first responders and all of those things that people feel are calling. I mean, I don't want to be judging here. Maybe you felt called to be an accountant. Like there are lots of things that, like that you might feel this, like you said, this deep calling to do. And then it's 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 not the rewards are not being outweighed by, or the rewards are not outweighing the difficulties, and there you start to, like you said, relate differently to that occupation, and it doesn't bring you the joy that hopefully doing the thing you felt called to do would. So can we talk now about what some of the physical and mental symptoms of somebody who is going through burnout may look like?
Yeah, it can show up in so many ways. I mean, I think just this, chronic state of fatigue and just low energy is, finding it hard to get out of bed in the morning. You're dreading, or, going to work. You're dreading clinic. You're dreading whatever it is. You have the Sunday scaries. There's, or, medicine. There's not really Sunday scaries, but like it could be just, yeah, that dread, just a profound disconnection from emotional numbing and dissociation, and disconnection, not feeling connected to your patients at all. There's just no bandwidth for that. It can be hypervigilance when you're not, like, this particularly shows up for physicians who take call regularly. And so you're always kind of, even if you're not on call, in a state of this hypervigilant state, like waiting for the ball to drop. And irritability with your loved ones, an inability to be present with loved ones, an inability to relax. You spend thousands of dollars on, oh, finally have a vacation, and you can't really relax and enjoy the vacation. Yeah, it can show up as sort of number of self-sabotaging behaviors, whether that's, like overuse of alcohol, any sort of substance abuse. It can show up as disordered eating in some way, stress eating. I think that, a lot of we like to put, especially as physicians, we like to sort of categorize and diagnose and like place into buckets what call it depression, call it anxiety, call it chronic PTSD, but it's really just an amalgamation of, like, where you kind of not able to live your fullest, most expansive, highest excitement kind of self, the self that we all, like, actually, I think, dreamt of. When you go back to when you dreamt of becoming whatever it is that whether it is a doctor or a teacher, social worker, what have you, it's like we had this sort of idealistic dream of what it would look like and feel like, and the kind of person we would be showing up as in whether it's professionally or personally. And when we're not, it's like when you finally get there and you're like, oh my gosh, this is not at all how I dreamt it was going to be, is this sort of disillusionment process. And then we cope in all sorts of different ways. It could be overworking, an inability to turn off, and an inability to say no, an inability to set boundaries. And it's like a constant kind of self-betrayal or death by a thousand cuts happening, because we're terrified about, actually making those changes. And so, yeah, I would say it shows up in all those ways. And then I also particularly see it show up in like in challenges with family, whether it's your spouse or in particular marriages will suffer because of it. And sometimes I see, people being willing to sacrifice the marriage before changing the professional circumstances. And so, yeah, we see that over and over again. So yeah, it shows up in all those different ways.
Yeah. And I think a lot of these areas that take years and years to get to, be it, somebody high up in research or another field that takes a lot of education, you have significant educational debt, and then you can't walk away from the career. You can walk away from the marriage, but if you walk away from the career and you've got $250,000 in educational debt, like maybe somebody I know here does, right? Like you just can't necessarily walk away, but the marriage maybe that's a cheaper thing to walk away from. I mean, like there's this, I think a lot of people end up feeling very stuck. And I think that probably contributes a lot to burnout, is that you don't feel you have options, and that it, if you were doing a job and you knew that in 2 months you were about to retire, I think the hardest things would be still so much easier to deal with than the thought of I'm stuck doing this for the next 20 years, right? It's so much about like, do you have hope? Do you have options? Is there some light at the end of the tunnel, and that tunnel is short versus very long?
For sure. Like I call them the golden handcuffs. Like it for sure that it creates that financial scarcity piece. And when we're in scarcity, well, we're back into a survival mode mindset. And when we're in survival mode, the blinders come up and we get really rigid in our thinking and we just can't see options. And it's also sort of a form of, I hesitate to go here because it can feel like victim blaming, but it's like victim mindset where it's like, okay, I feel shackled and therefore I'm just going to martyr myself here and just, like this is my cross to bear kind of. But I always say too that like, look, you don't, when you're shifting from survival mode into thriving, like, yeah, we like if you're relating to your job in this way, in this burnout kind of capacity, then yeah, you're not going to like it can feel like an oppressive sort of life sentence to be like, oh, I can't imagine another 20, 30 years of this. Something has to change. And I always say, like, it doesn't have to be like I'm interested in career longevity for physicians, like how to help physicians stay in medicine. And so, like, how can we shift the way that we relate to our jobs and it so that we can stay in medicine, so we can practice. And I think sometimes when like we can get into sort of black and white binary thinking that like, oh, it's either stay the way things are, or I have to like burn the boats, do something dramatic, and like, and that's too scary. So I'm just going to stay where I am familiar. And I just want to say to that, like, oh, there's other options between those two.
Right. And I just before we get to psilocybin, last thing I'd like to add is that those people who do decide that they are, by the way, all of a sudden just a thumbs up appeared on the screen and your hand's nowhere near the computer and neither is mine. So, odd. Anyway, those who are feeling like, okay, I'm going to try to find something else. And there are so many people I know listening to this because there's so much in our society about get your side hustle, get this set, must have multiple streams of income, all of these things that you look at as potential ways to not be stuck in this role or job that was not working for you. Those come with their own burnout. Entrepreneur burnout is super intense. It's real. Founder burnout, intense, real. And then a lot of people who are trying to start something, they can't just up and leave the first thing. And so now they are what used to be their off nights are now their, and I still see this after your 9 to 5. What are you doing with your 5 to 9? Oh my gosh, I would be resting if I had the option. But these people are now like having to entrepreneur and do all these other things, but because they still have to have their day job. So I just want to recognize anybody who's in that position because you're like, I know that I want better for myself. I know that I want to get out of this burnout situation, but man, the burnout that can come with getting out of the situation is also very real. So I'd love to ask you why something like psilocybin may be thought of as an effective treatment or an effective way to address burnout.
Yeah, the way that psilocybin can play a role in this is getting back to well, healing the nervous system is how I really phrase it. Is like coming into deeper connection with our bodies, ourselves on a somatic level, and also just getting into deeper relationship with our the egoic construct that we've developed, which is really an adaptation to our core beliefs about the world, our place in it, and all of that. And so I say to people who are looking into working with me for specifically to address burnout, it's very much like addressing, I would say, emotional processing, basically just like the emotional backlog that happens with this line of work that we do. There's no space for whether it's personally or professionally. Our jobs are just so fast paced and go, go, go. You can experience a death in a patient or a death in a family member, and you just have no space to grieve. And so this is sort of like one sort of core area that I see psilocybin playing a role is just creating these spaces where we can process emotions and integrate them. Um, the next way is just deepening into our why. And that's sort of getting back to examining kind of the core wounds that we all carry subconsciously that are feeding into the unhealthy relationship that we have with tying our identity to our self-worth and the job. And so it's sort of, it's sort of like separating those or creating separating them is the best way to put it. And then the third way that I feel like psilocybin also helps is with just healing the nervous system. So a lot of physicians will actually consciously be aware of the changes that they are longing to make with their current situation, but they just they'll rationalize themselves or fear. It's really just like unexamined fears keep them from making those changes, and so it's a way to sort of like look at the fears that really our ego identities create to keep us safe and familiar and to look at those from a different perspective, the different perspective that you get in the psilocybin journey, and then actually have the flexibility of mind with the increased neuroplasticity that's available after the journey to actually implement the changes, like take action on those changes that you've been longing to take. And so it really helps, I think, from like specifically for burnout in those three areas.
Very nice. And I would love if you could discuss. So, Dr. Tony Beck was supposed to come on years ago, maybe not years, this months ago, and talk about the study that they did on psilocybin for frontline healthcare worker burnout, but he was not available to. So if you don't mind sharing this study that Tony and his colleagues had done.
Yeah, and kind of fun backstory to that. I was at the Horizons Northwest conference when Tony spoke at the conference, and this was while the study was actually ongoing. I think they had just concluded, but they hadn't yet published it. So it was really cool to then see the publication in JAMA in December of last year. So yeah, this was a study looking at psilocybin therapy specifically in frontline clinicians. There were 30 clinicians who were reporting symptoms of depression, PTSD, and burnout after being on the front lines during the COVID pandemic. And so what they did was this is a randomized double-blind placebo-controlled trial. they, split the groups into 15 and 15. Half the group got the psilocybin intervention, and then the other half got niacin. It was an active placebo. And they looked at three different scores, one for depression, the Montgomery-Åsberg Depression Rating Scale, and they also looked at a burnout scale as well as a PTSD scale. And the psilocybin arm saw a 21-point drop in the Montgomery-Åsberg Depression Rating Scale compared to just a 9-point drop in the placebo control group. And just to put that into context, SSRIs, which are sort of the gold standard intervention right now for depression, usually result in about a 9-point drop which is really no better than placebo, which was demonstrated in this study, whereas psilocybin showed a 3-fold drop. I mean, there's really no other intervention for depression that we see with that dramatic of results. There are also improvements in burnout and PTSD. They didn't quite reach statistical significance with the 30 participants in this particular study. But what I found to be most fascinating about the study is that there are no adverse events. There are no sort of, I think people worry about bad trips or psychosis or anything like that. There's none of that. And 70% of participants, let me back up. 100% of participants stayed in healthcare after the study, but 70% made changes in their career to restructure it to have better mental health.
Was
So
that in the psilocybin group or across all of them?
That was in the psilocybin group.
Oh,
I
very
believe.
cool.
Yeah, I believe. So that, I mean, I find that to be really remarkable just because, look, you don't have to leave medicine. Like you can get to the point of burnout where you're just like, oh my gosh, I'm part of physician groups where, especially particularly women physician groups where people are fantasizing about going into real estate or even becoming a barista after becoming a physician. Like anything would be better than what I'm in now. And it's like, look, you don't have to leave your job in medicine. Like there's actually like ways that we can, be a little bit more imaginative to make the changes here. But like I said, we get so rigid and boxed in when we are in that survival mode that we fail to like have the imagination to make the changes. And I think specifically too about like if we take like a case study of a physician I worked with, he's a fellow subspecialty surgeon, and he was, burnt out, experiencing challenges in his marriage, and he also was grieving the death of his mother. And was drinking 9 cups of coffee a day to cope with just the like utter lack of energy that he had in his life. And this is a guy too who works in private practice and really values autonomy and had worked, he's about 8 years into practice, so like had worked really hard to get to this point in his career. That was the dream. I was like, oh, I'm in private practice. I have this full autonomy. I'm like, financially good to go. And yet still couldn't set the boundaries that he needed to actually exercise that autonomy, to actually say no to things, or maybe shift the clinic or OR schedule around to have a little bit more, time and energy for his own self-care, for example. He just couldn't say no if, like somebody asked him to squeeze in one more patient or what have you. And so but then after his psilocybin experience, he was able to do that. And wow, you could see like he went from drinking 9 cups of coffee a day to 1 cup every 3 days, he was saying. He was just so amazed. Like he was reporting that, I had long-term follow-up with him for a year. And could see the changes that he is making. And still, another thing that I think is remarkable too is, and I think this was cited in this study in particular, there's actually like you continue to see the benefits. So if you check scores immediately after the journey and then at 6 months out, there continues to be improvement in mental health scores, which I just think is really remarkable after a one-time medicine intervention.
Yeah, I think I'm glad you put a point on that because I'm assuming that what happens, I mean, we know that the window of neuroplasticity for something like psilocybin is 4 weeks. No, I'm sorry, 2 weeks. But then after that, I'm hoping that in that 2 weeks is when they made a decision to do other things that will support their mental health. Maybe they started going to a therapist more regularly, or they started setting the boundaries like you discussed, or maybe they had some hard conversations with family members or coworkers, because in that 2 week period you feel like things are more possible and you feel more connected. And I think it sets you up for success for what, if you use those 2 weeks well, like you said, hopefully the trajectory just continues to go upward after that.
Yeah, I mean, I think the window of neuroplasticity is actually longer than that in practice. Like it is fascinating to see, like the psilocybin or any psychedelic experience really just catalyzes the flexibility of mind. You can actually keep the momentum going when you implement new practices in that sort of golden window, and then you can maintain that flexibility of mind for months afterwards. And so you continue to see changes. And also just when you get onto that path of cultivating more well-being in one's life, where you're going to start to reap the rewards, and it's a sort of positive feedback loop.
Yeah, absolutely. Are there any other types of, so I'm imagining another important shift that may happen with something like psilocybin, considering that with higher doses of certain psychedelics, ego disillusion is a possible occurrence where you no longer identify yourself as that identity you may have gone into the journey with. I am not a doctor. I am a person who happens to have a medical degree. I'm not a lawyer. I'm a person who's gone to law school, right? I think, do you have you seen in the people you work with that that loosening of the grip on their identity has been helpful?
Oh yeah, big time. I think that's sort of like the core therapeutic like piece of this is if we can reach that sort of ego dissolution stage of the journey where there's a loosening of our egoic identity, and it's like, oh wow, we're sort of settling into that deeper more prior state of consciousness that comes, that awareness that is below or prior to the egoic identity. And so that's sort of what, Buddhists would call our true nature. And so we can sink into that and we self-source from that space how regenerative and it's sort of like tapping into a wellspring that is eternal and infinite. And so we're no longer sourcing from, yeah, egoic wounding. We're sourcing from that deeper place. And that's where I really see the energy really shift for people. And also just I mean, I remember my first large dose psilocybin journey. Which was very much like having the experience of, wow, I almost was turned towards, I was a few hours from where I was doing my residency in LA, closer to this is in Southern California in the desert. And I remember turning sort of northwards towards LA. We were outside, and I had this like very distinctive experience of seeing myself running around LA, like in my residency program, with all of the fears, concerns, anxieties, insecurities, everything that was just sort of my little self that I had been concerned with. And I was for the first time inhabiting this more expanded sort of meta state of consciousness, or really stepping into my higher self that could see all of the ways that I was getting lost in illusion, really day to day, all of the mental projections that I created to sustain this sort of perpetually or chronically stressed state. And so when you have that, and it's just like a very particular, distinctive and experience in the psychedelic state of consciousness, you can't unsee that. And so and sure, it's easy to just like, if you want to, you can just fall back right into the little self and get consumed with all the little tiny things that ultimately don't matter. But you can instead, and this is where integration really plays such a huge role. And I think that, yeah, having a someone to help facilitate that for you, whether it's a coach or a therapist or community or something like that, to help you cultivate that higher state of consciousness or that higher self, that is what really helps to shift the state kind of more permanently. And it's not that we don't reformulate our egoic identity. I mean, it's necessary for us to move about day to day and just to be a creature on this planet navigating our environments. But it's just that we have those egoic identity structures, and we have the more expanded state of consciousness that's beyond that.
Yeah, I love that. I feel like I'm just going to throw in a little disclaimer here. To echo what you said about working with somebody in the integration period, because I'm imagining somebody with deep burnout goes into this ceremony, realizes, oh my gosh, I need to leave my job. And then in that very volatile, like period afterward where everything seems possible, they just up and leave it with no backup, no safety net, all the things. We always say, do not make giant life decisions in the period immediately following your ceremony. Work with an integration therapist to you can make those changes in a way that is going to work out best for you in the long run. But I think what can immediately start to help burnout is knowing that those changes are possible, right? Those might have seemed impossible going into it. And once sometimes even you've heard this a million times, but like once you've decided to make a change, things start to shift already. Like it's not like such a cloudy day all the time. I mean, I left clinical medicine after 9 years at some point, and I distinctly remember the day I decided to change and to leave. I didn't, wasn't like I walked out the next day. I had to give a month's notice, but the clouds started to part, And so I think that's probably what people would come out of that with is like hopefully some sense of possibility.
Yeah, I mean, I always say too that you actually don't have to change anything in your external circumstances to experience transformation. When you transform internally, the way that we co-create our reality, construct our reality, our relationship to anything and everything shifts. And so I had my most transformative, psychedelic experiences in my intern year of training, because I was staring down a 5-year, general orthopedic surgery residency, and I knew I wanted to do a fellowship year as well. So 6 years of surgery training. And I was, already at the beginning of my training thinking, before I had these experiences, oh my gosh, I don't know how I'm going to survive this. How am I going to survive this? And I wanted to get married and have a family and have children and all these sort of like life milestones that all of it felt just like overwhelming at the time. And so and then I had my transformative experiences, and they allowed me to thrive and not just survive in residency training, which is, the most demanding years of our medical careers. And so I always say, like, if I can do it residency training, I didn't have any say in what my hours and days looked like, right? I was just like, and so I was completely subject to, I showed up where and when they told me to, but the way that I related to my work completely shifted. And so that's where, and I was able to process, what it is that I was experiencing and integrate it. And then I could tune into the real joy and beauty and just gratitude that's available within the practice of medicine, even as a resident. I mean, there's so many beautiful moments that when we're, feeling burnt out, we don this shell to really like protect ourselves. And that protects us from, the more painful aspects of our jobs, but it also, cuts us off from the immense beauty that's available there too. And so that's, I was able to tune into that beauty in a way that I just wasn't able to before when I was in my kind of my burnt out state. And so I always like to remind people that like, hey, you just don't know how you're going to feel after the experience. It's impossible to predict. You just, keep an open mind and see. And yeah, you never know. It's actually, I haven't come across anyone yet who's been, come out and been like, I have to quit my job or I have to move or do anything dramatic. It's actually, it's a little bit more of a mysterious process there.
I love it. I love it. That also speaks to a well-prepared uh participant.
Yes,
Yeah.
that's key. Preparation is key. Absolutely.
Yes. Well, I love your story, and I think it's a beautiful way to end because yes, it may not be about changing the circumstances, which very often are much more difficult to change, or sometimes, like you said, if you wanted to be an orthopedic surgeon, that residency was not going to be changed. You had to go through it. And so, what can we do? We can change how we move through those situations. So, I am very grateful for you coming on, sharing your story, sharing the research, sharing some possibilities. Where can our listeners find out more about you and your work?
Oh, thank you for that. Yeah, they can find out more about my practice at meadowmedicine.org. That's just my psilocybin therapy practice. It's based here in Portland and operates within the legal framework here under Measure 109 and Oregon Psilocybin Services. And then I also share quite a bit on social media. I have a little Instagram. You can find me there at Tracy K Townsend MD. And then I also have a YouTube channel as well. If you just search my name, you can find it.
Very cool. Thank you so much for joining us and for sharing all of your knowledge with us.
Thank you so much for having me. This was fun.
I appreciate it. All right. For everybody else out there, until next time.